If you've liked the things that you've seen on the Get to Know OCD podcast and you want to know more about OCD, you can go to NOCD.com. We have tons of education. You can go to our NOCD YouTube channel and watch our webinars and other episodes of the podcast. And we hope that you will take advantage of everything that we have available to you. Hello and welcome once again to another episode of the Get to Know OCD podcast. My name is Dr. Patrick McGrath. I'm the Chief Clinical Officer for NOCD. If you're looking for help for OCD or related conditions, check us out at NOCD.com. That's NOCD.com. And if you like the podcast, well, subscribe on the NOCD YouTube channel or get it where you get your favorite podcast from. I am really excited today to talk to Rebecca Deusser. She is now the lead, the charge, the person at the International OCD Foundation. And so, Rebecca, I wanted to give you an opportunity to introduce yourself and a little bit about what you do. And then we'll talk about how you got here and got into the field and all those things. So we've got plenty of time to get into a bunch of stuff.
It's great. It's so great to be here. Thanks for having me. And both you, Patrick, individually, and NOCD are just outstanding partners to us at the International OCD Foundation, which is what IOCDF stands for. Mm-hmm. My role is the executive director. So similar to what Patrick was saying, I run the organization. I started last year in January 2024. It's been a wild ride, very, very exciting first year on board. And I really oversee all parts of the organization, from all of our external work, working with partners, advocacy, and then internal work, fundraising, budgeting, and thinking about our strategy and what's next for us and how we can best serve our community.
Tell everyone kind of where you came from. You've been in the university healthcare policy world for a while, but this is a shift for you now, working in a nonprofit, if I'm correct in some of the work you're doing.
Yeah, absolutely. So I say this frequently. This job is truly a dream job for me. It started, my interest in mental health and policy work and advocacy really started a good portion of 20 years ago, which is terrifying in some ways. When I was much younger, I worked for Governor Deval Patrick, who was the first Black governor in Massachusetts in the early 2000s. And in that work, I learned quite a bit about advocacy, communications, public policy, but also specifically the impact that mental health has on really every facet of life in our communities, whether it's education, public safety, healthcare. And from a really early stage, I knew that I wanted to spend my time thinking about that and how we can make improvements and remove barriers to care. And personally, I have an older brother who has bipolar disorder. He's doing great now. He's almost 50 years old, doing extremely well. And but for a number of years, there were a lot of struggles for him and for my whole family, just me as a sibling. And so while I don't have direct experience with OCD kind of within myself or my family, really understand the effects that mental health can have on the whole family unit. And back then, it was sort of the late 90s and very stigmatized still. I mean, I think we were, kind of middle-class, average family. My parents did everything they could to help my brother navigate getting effective treatment, but it was very, very difficult then. And I think continues to be, even though things have obviously changed since then. So I have a real passion for advocating for removing barriers to care for mental health, and now specifically for OCD. Just to speak to it, if it's helpful, the last 6-7 years, I worked in healthcare for a health system called Tufts Medicine, based here in Massachusetts in the Boston area, with an academic medical center as its flagship hospital, and really learned a lot about how healthcare works, how insurance works, where the areas that public policy affect healthcare and access to care come into play. And just a real general understanding as well for working with clinicians, working with medical doctors, how research works, and how higher education institutions work as well. So I think all of those things will help serve me in this role.
Awesome.
Yeah.
Going back to that earlier, I was interested in, you said working for Governor Duvall. I mean, were you there during the Boston bombing? Because I'm thinking, boy, talk about some mental health issues that would be going on across an entire city and state in that kind of situation.
Yeah, absolutely. So I wasn't working in the governor's
Okay.
office at that time. I was working for a quasi-public agency called the Mass Clean Energy Center, but was definitely present during that time. And it was unreal. It was like very few things I've experienced. Maybe COVID maybe slightly overshadowed that in a different way. But yeah, I mean, just the city being on lockdown, the way that so many agencies had to respond to that and the effect that it had on people was a very real thing. And unfortunately, I think really common in a lot of cities in the US.
Sure. So you said this is your dream job. Tell us more about what is it about the job posting that you replied to that you were interested in, the interview process coming in, and
Sure.
what do you think kind of tipped the hat toward you being chosen as the director?
Yeah, great question. So I had known, like I had said for a long time, I wanted to lead a mental health focused nonprofit organization. Jobs like that don't come open very often. And especially knowing that I wanted to stay in the Boston area for my family, it got even like somewhat more of a narrow scope. So while I was really committed to my work before, I was always, aware of opportunities if they would come up. So when this one did come up, it really just checked every single box in the type of work that I wanted to be doing. What was really exciting about IOCDF was, one, it's been around for nearly 40 years, so it's very well established and a really well-run organization. The volunteer community, of which you're a part of in several different ways, is so strong. The community of lived experience individuals is also so strong. It's warm. There's a lot of caring. Because our community is still somewhat small in terms of the people who I'd say interact with us on a regular basis. There's a lot of intimacy and caring and recognition of one another, especially across researchers, clinicians, people with lived experience in a way that I've never really seen before with a lot of organizations that I'm familiar with. And what spoke to me the most, too, is that I felt like I could take all of my skills and all of my passions and put them to use for something that I wake up every single day feeling so strong and excited about. And that's a really good feeling. And I feel like not everyone gets that chance to really love what they do. So that's what spoke to me about the job. And, the interview process. So we have a board of directors. Susan Boaz was the president of the board at that time.
Hi,
and
Susan.
I know, hi, Susan. And, she was really the first person I talked to. And I think within minutes, at least on my end, I felt a real connection with her, and her representation of the organization, what they were all about, was really strong, really positive. My charge from the board and what they were looking for was someone that was going to build on all the success that IOCDF has had for many years and just start to think about how we can take it to the next level, how we can start to reach many millions more people who are affected by OCD around the world, and grow. And so I think because of my background and my passion for those things and having ideas on how we could think about growing awareness about OCD and helping grow our community, there was just a lot of mutual excitement on both sides. And and as they say, the rest was history.
There we go.
Yeah.
So you have a unique perspective. You come into this experience without, I'm not saying it, without OCD experience, right? I mean, that's, and you've had to learn a lot about OCD. Now that you're here and you're learning about it, there's always those things that you think about OCD before you learn what OCD is and now after. What's that been like for you? Oh, I'm so OCD or oh, I got a little of that. Yeah, I'm sure you heard those things before this job, and now you've got an entirely new perspective. So this is always fascinating to me. How has that transition been for you?
Yeah, it is such a good question, and it's really been impactful. I'll share, I have a really close friend from college whose son has OCD. But beyond that, I really haven't had a lot of direct exposure with people who have OCD, or even parents with kids who have OCD. My second interview for the role, when I came to the Boston offices, I was doing a meet and greet and saying hi to some of the staff there. And someone had a poster on their wall. It was Kristen Lynch, who's our director for fundraising and development, that said OCD isn't an adjective. And sort of right away, that struck me as, like, wow, that is an excellent point. And I think, like everybody else, I think most of my consumption about understanding OCD was from movies and TV shows and characters, which I think we both agree are usually don't tell the whole story at best, and at worst have some real misconceptions about the disorder.
Yeah.
One of the things that strikes me the most have been two things. One is that the level of suffering and quiet suffering that so many people are dealing with OCD has been incredibly impactful. I can't tell you how many stories every single week I hear, whether it's people with OCD themselves or parents with kids with OCD or otherwise. It's really unbelievable how little known there is in the awareness that the way intrusive thoughts can just be so damaging and so hurtful and harmful, and that it's so difficult to talk about it and share what's going on inside has stood out. The second thing, though, Patrick, is so many people I've met, what they've been able to do when they've found effective treatment and what they're able to overcome. And then in my instance, the way that people are choosing to give back and work with the IOCDF and volunteer is just knocks me out, every day. It's just unbelievable, the journeys that people have been on, years and years, if not decades, of living undiagnosed, and some people not getting diagnosed until they're in their 50s or even 60s, and still choosing to give back to our community in a way. It's so beautiful and touching.
There's been a lot then going on since you joined IOCDF, working up into some strategic planning meetings, and now this new plan for the future. Could you kind of tell us about that and what you're excited about and what we should be looking forward to from the IOCDF in the next decade?
Yeah, absolutely. So it's been an amazing process to get to this point, to have a strategic plan. And I think, again, the organization's done really well, but we're looking to really significantly broaden our reach. This, I know, and NOCD as well. Up to 240 million people worldwide have OCD at some point in their lives. And that's a lot of people to try to reach. And we've been very US focused, although we are an international organization. So one of the things we're trying to think about is how we can grow our presence globally and what that looks like for us. Because there's a lot of other cultural barriers, language barriers, healthcare access barriers, not just within the US, but in every other country. So the strategic plan itself, it's a 5-year plan. It gets us on a trajectory to try to solve a couple of gaps that we saw and that we've learned from all these listening sessions that we had over the past year in 2024. One is focusing on increasing public awareness about OCD, which we've always done, but it's not just increasing awareness, but increasing correct awareness about OCD. And,
right.
Try, like what we were just saying, trying to really knock down a lot of those misconceptions and misunderstandings about the disorder, understanding how serious of an issue it is, how big of an issue that it is, and also that there is a solution to the problem. There's evidence-based treatments that help people and help them thrive. So that's the good news. I think there's a lot of work to be done to just keep amplifying that message and reach a lot more people with that message. Second is looking at ways we can advance research.
Okay.
Interestingly, I don't know if it matters if we're time stamped on when this comes out, but in February of 2025, a hot topic is proposed cuts to National Institutes of Health funding for research, which we're going to be doing some advocacy around. But OCD research, as it is with federal funding, is woefully underfunded compared to other disorders with a similar prevalence rate or even a lower prevalence rate, and by a factor of 10x, right?
Wow.
So over the next 5 years, we really want to work to find ways where we can advocate for more funding to come into the OCD ecosystem. We, as an organization, does some research grant funding directly. We do about $1 million a year, which is good, but really isn't sufficient to try to advance our understanding about OCD. What are the root causes? Are there even better, more effective treatments, ways to prevent in the future? So there's a lot of work to be done there to advance research. The third area, which of all the things we do that I think are important, is probably the most important, which is to increase access to effective treatment. I think that's really the core and the heart of where we can have the biggest impact in the world. And what that looks like is helping to increase the number of clinicians and people who can treat OCD correctly. And then increasing more awareness about what the effective frontline treatments are, secondary treatments are, really helping educate people on what a treatment journey might look like. And in the spirit of that, we want to try to change our approach to advancing some of those things in a couple ways. One is to think differently about our role in this OCD ecosystem, which NOCD is a part of. It's really grown and changed, I think, in the past few years, especially. There's a lot more players, which I think is great. I think there's more interest about OCD. There's more awareness of OCD. And but with that, I think IOCDF, I like to think, is kind of at the center of that in terms of, we're the nonprofit organization that can lead the way on things like advocacy and having an impact on public policy, which is something we've done in the past, but not in a really proactive way. And so I think over the next 5 years, folks can expect to see a lot more of us engaging on key issues that affect whether it's funding for research, helping create more opportunities for there to be better insurance coverage for frontline treatments for OCD, ways to increase awareness amongst governmental decision-making makers, and whether it's, I don't know that we're really on the radar of a lot of key agencies within federal government, for example. I don't know that there's a lot of engagement with legislators in different states and all that. And that's something we want to just start to work on and just, like I said, increase awareness and educate decision makers about that. And another thing that we want to focus on is really increasing the number of partners that we have, whether it's within our ecosystem or beyond. We're small. We've got a staff of about, I think, including me, about 23 people. Which is great, and it's grown over the past few years. But I like to say we're small and mighty, and we really rely on our volunteers and our partners to amplify our work and amplify our message. Within the U.S. and worldwide, we have 42 affiliates within the U.S., which is great. We have a number of global partners, which is also great, but we really want to build that up. So there's a lot of, mutually beneficial ways to share message, because a lot of us and organizations that do similar work to us, we have a lot of shared goals. Everyone wants to increase access to mental health care. Everyone wants stigma for mental illness to go away. And how can we work together with other organizations to make that change happen faster? And then the third area is really trying to dig in and focus more on kids and families. Just at the top of the interview, I was talking about my family experience with bipolar disorder, my friend's experience, seeing her really have to navigate the mental health system to help her son in the school system was not easy. And that's in a state that I think is known for really great healthcare. She herself is a brilliant, wonderful mother, and really had challenges finding effective help for her son, who's doing great now. And there's a lot of ways that we want to do that. I think we have great resources for adults. I think we could do a lot more to help increasing awareness about those resources and disseminating it further. We don't have as many resources specifically for kids and caretakers. So that's something over the next 5 years we want to think about, having more programs, more resources, more ways to have community amongst caregivers and amongst young people. And then similarly with research, making sure there's enough of a focus for pediatrics on research as well. So that's just the tip of the iceberg. I could go on and on about our vision for the next 5 years.
I don't think that's enough. I think you should have much more. No,
bigger goals. Yeah.
Go big, Rebecca. Go big.
Yeah.
Yeah. Well, I like what you said too, because and I've never been shy about this, and I brought this up in our first listening session. If we're going to be the International OCD Foundation, we really should be international. So I'm thrilled to hear that there is a push really into that area.
Yeah, same. I think there's a lot of good foundational work that we're doing. people may not know, we've piloted some training programs for clinicians in some countries, including China, Singapore, and Mexico. There's been good early results with how that went. And we'd like to look at ways to expand that. We do have a number of global partners in countries throughout the world. But there's just different challenges and different barriers on what types of resources are actually helpful in some countries.
Yeah.
And also just the extent to which there's organizations that even focus on OCD in a lot of countries too. So lots of work to be done there, but exciting work.
The annual conference is unique in that it is not just people who treat OCD, it's people who have it, their families. I'm wondering what your first conference experience was like, because it had to be, I'm assuming, quite different than any other conference you'd been to. And I'd love to hear that from you.
Yeah, it's a great question. And when I first started, the organization was really in full swing on conference planning mode. And so I knew it was a really important thing, but I don't think I fully understood the importance and how great it is. And just a real gem. And I think one of the most important things that we do. My first conference was exciting and a little overwhelming at times. I think the staff really shines in that setting. It's so professional. It's so well done. It's so thoughtfully put together. Like I was saying earlier, it's so special to have leading researchers who have been experts in the field for decades, talking with someone who's a parent of an 8-year-old who's there for the first time. And you just don't see that in a lot of places. And bringing all those groups together in one way with some common interests and common goals is so special. I think the focus on some of the related disorders was also great for me to learn about and get exposure to as well, and start thinking about, how we can be doing more to support, in addition to OCD, hoarding disorder, BDD, body dysmorphic disorder, to spell that acronym out, and others, right? That I think there's a lot more to do there. I'll share too, at that time, I was actually recovering from treatment for breast cancer. I'm doing great right now.
Awesome.
Prognosis is excellent. Yeah. And so I think it was actually an interesting time for me to have gone through kind of my own health challenges, physical health challenges. And I think it just underscored for me, how passionate and happy I am to be focusing on this work. And it brings so much meaning to me in my life to be spending all of my professional time on this topic, and to have that all be coming together at the conference in that way was really, really special and just electric.
Yeah.
So I'm excited for Chicago
me
in July
too.
of 2025. Yeah.
I commend you. You had a hell of an intro into it's like, I'm here. Oh, I have cancer. And the conference. I mean, it had to be, the whirlwind you went through when you joined it. It's, I applaud your tenacity to just push through as you have. It's really inspiring.
Oh, appreciate that. It never feels like that at the time. I think you're just trying to, work through it. And I really do mean it. I think there were times when I was going through difficult things, but the work is so rewarding. The board of directors, the community, people like you, the staff were just incredibly warm and supportive, really, from the beginning, without knowing me very well.
Yeah.
And those were all signals that I'm in the right place. Yeah. So it was great to have that going through something difficult in my personal life.
What are you excited about for Chicago and the conference coming up? Any tidbits you could share with us?
Absolutely. Yeah. So I'll let folks know July 11th through the 13th in 2025 in Chicago. Please sign up. Registration opens at the end of March in 2025 on the IOCDF website. So please check that out. Some things that I'm excited about that I can share. One is that last year we piloted having some hybrid options that NOCD sponsored for us. So thank you, NOCD, for that. We're going to be expanding that significantly and having almost all of our tracks hybrid so that folks who can't travel for some reason, and particularly our international audiences, will be able to participate in the conference in a way that wasn't possible before. So I'm very excited to see how that goes. Last year we had
sponsoring that again, just so you know.
You are sponsoring that again. I did hear that. So thank you for that. We'll continue to thank you all for that. I think it's great. It's a good investment into our future. And again, these are ways that we can really grow and broaden our reach in ways that we just weren't able to do that before. So that's one. We do have a keynote speaker who I can't announce yet that I'm very, very excited about. That I think is going to bring a lot of meaning and interest to the work and share her lived experience with OCD. So more to come on that. Also excited, it's our 30th anniversary of having the conference, which is hard to believe. Yeah. So being in a city like Chicago, our 30th anniversary of the conference, I'm hoping to see, record numbers and people coming to attend. Two other things I'll mention. One is that we're adding more programming around some of our related disorders. So those tracks will also be hybrid. And we're also expanding our hoarding disorder track from 1 day to 2 days.
Oh, nice.
So we're expecting to see a lot more interest there. And those are some things that I'm excited about. And like always, it's going to be fun. It's going to be interesting. The networking and meeting people is going to be fantastic. And so I think it'll be all the great things that are wonderful about the conference. And we're adding in some new things to keep it exciting and fresh.
What have you heard from the families as you interact? What do they get out of the conference, especially those first-time attendees who are nervous and like, should I talk to anybody and what's going on? How do you see the experience for them?
Yeah, it's a great question. I actually met with a number of people who were first-time attendees. There was a gentleman I met who was there traveling with his adult son, who I think he said was in his early 20s. For him, it was a mix of relief that there were so many people he could immediately relate to, whether it was other parents or just young adults on behalf of his son. But then also this feeling of like, I just wish I had found you sooner. Like years where we could have been benefiting from these resources and the supports and being at the conference. And again, that really fires me up so strongly that we have such a great resource here, and how can we reach more people and make them aware of it? I think the other thing is there's such a hunger, especially from parents. And I'm a parent of a small child myself, who's happy and healthy. And at the same time, I have endless questions about, am I doing every possible thing I can to support her and ensure she thrives in her life? So I think a lot of parents have just a lot of questions on what else they should be doing. What else do they need to know? They need to know how can they find the best care for their kids? And those are some of the things I think come up really frequently. And kids themselves, I think they're excited to meet other kids who have OCD, who are like them, and have a connection in that way that they might not find in their day-to-day life.
I think that's so important to talk to, especially the increasing the awareness of OCD and the outreach you do, the outreach we do, the podcasts, everything. Why is it so important? I mean, we know some statistics, right? That idea that it takes 14 to 17 years for people to find the right therapist, all that suffering that people will go through. What have you seen personally now really working with the foundation in terms of why increasing awareness to OCD is just so important?
Yeah, a couple of things come to mind. I think one is just people finding community and finding connections where, from what I've learned so far and understand about OCD is that it can be incredibly isolating, especially if you're in your mind or in your thoughts and it's really hard to talk about. I think all the more reason why it's so important to get connected with people, whether it's parent to parent, kid to kid, clinician to clinician, right? There's a lot of importance there. I think also that because there's so many misunderstandings about OCD, and even with clinicians, even people who might actively be treating people with OCD, there's so much to learn. It's so nuanced. And thinking about what training opportunities do we offer and continue to offer, I think is another important way to raise awareness. Maybe not public general awareness, but more awareness about how you could or could not be helping someone who has OCD by the way you're approaching treatment.
And the family piece. I mean, the things we see with families, the stuff that they go through, the absolute torture at times that families describe of navigating the mental health system, insurance, payment, falling into traps of doing compulsions for their children without knowing that that's what they're doing. To me, I love that at the conference, that other parents get a chance to really, like you said, sit down with each other, share this, and hopefully realize they're not alone, right? Because there is an isolation in so much of this that I think we can help dispel a great deal of.
Totally agree that not being alone piece, but also it's not their fault.
That too, yeah.
It's a mental health disorder that a parent did not cause. And then I think thirdly, and again, as a mom, would be most important to me is that there is effective treatment that can help their kids. And so many young people who are diagnosed and treated effectively thrive.
Yeah.
And that's a totally possible. And it's interesting, since I started working here, I hear from people that I've known throughout my life or worked with in the past who are coming to me now and like, I have an 11-year-old who I just got diagnosed with OCD. Can you help me? And the first thing I tell them is that I have met so many people, young adults, who are thriving and doing incredibly well in their lives. And that's entirely possible for your kid too.
Right. Well, and I'm glad you said the not your fault piece, because it's always saddens me when parents want to say, did I give this to my child? Is it my fault? And I just...
It's heartbreaking. Yeah, it's
is,
heartbreaking to think about. Yeah. Mm-hmm.
Nobody wants to do the blame game. I never do, but it's so easy for people to kind of go there, and then that doesn't put you in a good mental health space to be able to help your child if you're now down and depressed out of the thinking that this is all your fault and what did you do wrong and all these things. Yeah.
Yeah, for sure.
As you've done your work throughout your career, I'm assuming that stigma in various areas has played a role. What role do you see the IOCDF has in helping to break stigma for OCD, but mental health in general, in addition to just the OCD component of it?
Yeah, it's similar to what I was saying earlier, even, 20 plus years ago, more than 20 years ago, 30 years ago, when my brother was going through his early stages of diagnosis, things have changed. I mean, I think there's such a more general openness and understanding that mental health is a valid, real thing and that there's treatment available. But there's still such a hesitation for individuals to talk about their lived experience, and even for family members to talk about family members with mental illness. I see it all the time. I'll meet with incredibly talented, thoughtful, wonderful people who are working professionally, whether it's within OCD or adjacent to OCD in some way, and they have OCD themselves and are very hesitant to talk about it publicly. Really generous donors who give funds to the organization to help us do their work. Many of them wish to remain anonymous for similar reasons. And well, of course, I understand that entirely, and that's everyone's right to keep that private. It really drives home for me all the time that there is just the stigma connected to OCD and to mental illness. I think the ways we can start to combat that or keep combating that is building our arsenal, I say, of advocates and people with lived experience who do feel comfortable talking about their lives and their experiences with OCD. That is an ongoing journey for them too. I think second is we can continue to try to find people of note, celebrities, others who a lot of people would recognize and see them, whether it's a athlete, whether it's a movie star, musician, and say like, oh, well, if that person has OCD and they can talk about it, then maybe it's not so stigmatized for me anymore. Or maybe I can have that conversation with my kid's teacher, right? Or maybe I can talk to my family members more openly about what I'm going through. And not just that I have a diagnosis, but what those struggles are like for me in the day-to-day.
Yeah, our work with Maria Bamford, Howie Mandel, Mark Summers, and others has been amazing. Just and so proud of them for reaching out and wanting to talk about this and be open about it. And I like that message of OCD is they may be funny, but OCD isn't a joke, right? Or an
completely
adjective
agree.
or something. Yeah.
Yeah. I mean, I think it's just like a different level of bravery, right? To be so vulnerable and open about something that is affecting you every day, that some people may think of you, judge you differently by knowing that about you.
Sure. You've spent so much time working on this 5-year plan, and now you have an opportunity to look ahead into the future. What are some things out there right now or in the next 5 years that you think could be stumbling blocks or areas that you're concerned about for the entire mental health community that you think we should all, just be aware of, push forward on? Is there advocacy to do about mental health, all of these areas?
Sure. Yeah, it's a great question. I guess in the here and now, in the US, I think we're going through unprecedented times, with our politics and government here. I feel hopeful that an area like mental health and advocacy around mental health is something that isn't political, right?
Right.
OCD affects everyone. It doesn't discriminate against any type of person.
Mm-hmm.
And so I feel a lot of hope that it's the type of area where a lot of people, regardless of what their political views are, can get behind that mental health is a serious issue.
I hope so.
And there are real barriers to care. So that's one thing. I think that said, I think there have been a lot of things that have been in status quo for a long time, and people could argue if that's good or bad, but things like funding for research, certain federal agencies that focus on data, that focus on getting information out about mental health disorders, have been so relied upon for so long, funding for public Medicaid and Medicare insurance funding as well. So sometimes I worry that drastic changes could cause unintended harm and unintended consequences. But at the same time, I think there's lots of ways to solve problems. So if things aren't working the way that they are now, and healthcare is definitely not a perfect system in the United States, and I could say that really strongly, having worked in healthcare. But I do think it's important to just keep an eye on that, where, again, like, changes with good intentions may just have unintended consequences that might end up hurting people in the process. I think just beyond that, in the advocacy sphere, is that there is such a barrier, so many ways that people can't access mental health care right now. Costs. There's a lot of clinicians that don't accept insurance for good reasons in a lot of cases. The burden of doing all the administrative work to be able to accept insurance is very difficult for clinicians that operate on their own or have small clinics. They're not bad people who are greedy. I think it's generally difficult to do all that work if you're a therapist of one or two, right? And I think geographically, there's a lot of places just within the US, forget about internationally, where there just aren't clinicians even remotely close by to where people live who have been trained and can do a good job treating OCD. So I think there's a lot of work to be done there to keep raising awareness about that. Just decades and decades of research point to what the effective treatments are, the frontline treatments are, but there still is a hesitancy, I think, for some of those clinicians to get paid for the work that they do at appropriate level. And then again, I think it comes into stigma and acceptance to seek out treatment to begin with. So I think that's the area where I think the most about. I think we can do a lot of work to raise awareness. We can do a lot of work to increase research. But it all can become moot, right, if people can't actually access the care that's going to help them.
Right.
Yeah.
If people can go through the battle of a mental health condition and come out on the other side, hopefully they can reach across aisles or share with each other what concerns are and be able to work together. That would be wonderful. So that is my hope too for everybody. I really hope that we see that.
Yeah, and I just want to say that, because this is an important part of our new strategy, we're already off to the races and focusing on that. And we're going to be spending time with decision makers at the federal level and at state level to just start to educate more people about OCD and what the barriers to care are. And I'm really hopeful that can make a big difference.
Awesome. Well, before we go, what message do you want to leave for everybody before we wrap up today?
I think a couple of things. I mean, one, just generally about OCD, can't say it enough. It is a really challenging difficult disorder, but there's reasons to be hopeful. There's a community here that's got your back through the IOCDF and beyond, and there is effective treatment available that can really help people thrive. So I'll say that over and over again till the end of time. I think second, it's just about the IOCDF itself. It's such an exciting time for us. We're growing, we're excited, we're motivated. There's so much positivity happening. Our ecosystem's growing. And it really feels like things are coming together in a way that's going to be so beneficial for the community that we serve. And I just can't wait to see what the next 5 years brings for us and beyond on, millions more people that we're going to reach. And like I said, that really fires me up. And I hope it fires you up, Patrick.
It does.
And everyone tuning in. I think there's a lot of great work ahead for us.
Awesome. Well, Rebecca, thank you for joining us today. I really do appreciate it. And thank you for all the work that the International OCD Foundation does on behalf of people with OCD and for those of us who work in the field as well.
Yeah, thank you. And back at you. Thanks for hosting this podcast. And thanks for NOCD for all the great work you're doing to treat people.
Absolutely.
Thanks so much.
And thank all of you for watching. If you like the Get to Know OCD podcast, check us out at our NOCD YouTube channel or subscribe where you get your favorite podcasts. And if you're looking for help for OCD or related conditions, go to NOCD.com. That's NOCD.com, where we have therapists waiting to meet with you. We look forward to hearing from you. Thanks for watching.